It's the dawn of a new decade. You can be you again with mini dental implants. Do you suffer with loose dentures? Are you embarrassed to smile because you're missing teeth? Mini dental implants will change your life.
I've had problems with my teeth.
I had this big hole in my mouth.
I would constantly talk to people like this.
I didn't even know what mini implants were then.
I knew it was time to do something permanent.
It's just unbelievable what it's done to my life.
I feel like me again.
It'll be the best, smartest move you ever made.
Kind of gave me my life back.
Mini implants are the only way to go.
Just real happy I did it.
I would recommend it to anyone.
Do it over in a heartbeat.
It's been great.
It's incredible. It is. It's absolutely incredible.
Hello everybody, John DeShula with you. Welcome to Innovations in Health. I'm here with Dr. David Ney from Ney Dentistry in Harrisburg, North Carolina. We are going to talk about the mini dental implant, Dr. Ney. And ladies and gentlemen, this is going to change your life. If you have ever wondered how you can get your self-confidence back, how you can enjoy the taste of the favorite foods that you love, the mini dental implant is here to help. Dr. Ney, this is a revolutionary practice, is it not?
It absolutely is. It's a real good game changer for us. You know, as actually docs, we're always looking for new technology, how to make things better. How can we help patients get through their lives better? This will change people's lives, absolutely.
And we should mention the mini dental implant, folks, is 5 times less. It's less invasive, less pain and discomfort, less healing time, less visits to the dentist, and less expensive. And I know a lot of patients come in, Dr. Ney, and they say, I need to get that sense of taste back. I need to enjoy a steak, an ear of corn, and what's our favorite food here in North Carolina?
The barbecue.
The barbecue, of course. So
That's
this
right.
is where you, ladies and gentlemen, can get that sense of taste back with the mini dental implant.
I had a lot of difficulty in eating.
I couldn't eat 3/4 of the food that I enjoyed eating because I couldn't bite down on anything.
I hadn't taken a bite of a cheeseburger in probably 10 years.
I couldn't eat almost anything.
But with these, I can eat everything.
Well, you got to eat for the rest of your life. Do something now. So I did.
I can eat everything. It's unbelievable.
It was done. Over. Done. Let's go home and eat.
I can eat steak, I can eat sandwiches.
So it doesn't slide around or move or worry about it falling out.
I had dinner 45 minutes later.
Secured, it's in place, things don't fall out.
I can chew a steak. I could not do that before.
I'm enjoying the fact that I can literally get a sub and just run.
I have not had a problem at all.
I don't have any problem chewing anything.
And my teeth aren't falling out of my mouth.
I would recommend it to anyone.
It's made a tremendous difference.
It's the best thing I ever did. I mean it.
I love it. It's life-changing.
I can eat anything I want. I'll smile at anybody, you know. It's outstanding. I'm happy. I'm very happy.
I'm very, very pleased that I have them now.
And you know what we should mention too, this is an FDA-approved process. This is something that's revolutionary, but it really is going to change your life. We're going to get to know Dr. David Ney in just a little bit, but right now I want to talk about the models and show you why the mini dental implant is something that could work for you. This is an idea of a conventional implant and the jawbone. Explain what we're looking at.
And so what's happening with the actual, the implant that people use, the conventional, is that they actually place a big hole in your bone, and they place the implant in the bone, and the bone has to heal back to the implant. That's why everything takes 3 to 4 months to actually heal. With this mini dental implant, which is the most versatile implant that I've seen, it's just phenomenal. And what you do is it's just a pilot drill, one little pilot drill, 1.2 millimeter diameter, and then followed by the actual implant. The implant integrates as it's going into the bone. Now, if it doesn't integrate all the way totally, what we do is, because it has this osseous surface, it takes 2 to 3 weeks for it to integrate into the bone. But it's very similar to you're putting a screw into actually wood, and the screw goes into the wood and just integrates into the chair immediately. You can typically use it.
So this example, this is the jawbone, but you see how much bigger the hole is on a conventional implant.
Absolutely.
And the bone has to graft, I guess, and
the bone has to heal
develop
to the implant.
Yeah.
Absolutely. So you put the implant in. Yes.
So that bigger hole has been replaced with the smaller hole that you see right there.
A pinhole, if you will.
Pinhole, if you want to call it that. All right, now let's look at an example from an upper denture.
Absolutely. What's great about the mini implants, again, they are so versatile, as I say all the time. The upper denture, the upper bone's a little softer than the bottom bone, so we typically need a few more implants, typically in between 4 and 6. But what we can do with that is we can cut that palate out, which means that big, thick part in the individual's mouth that they feel, which kind of prevents them from actually tasting. We can cut that out when we place the implants, change everything about how they taste food from there on out.
And it snaps right into place. So this is
Snaps
an
right back into
upper
place.
denture example. And like you mentioned, the top of that denture gets cut.
Top
so
of the denture gets
palate
cut, so it
comes
exposes
back.
the palate so that you can now taste food and you can now be a lot more confident with what that full denture is going to do.
Let's look at a lower denture example.
Lower dentures, same thing, except lower dentures are also called floating dentures because patients are very challenged by these guys. These guys end up floating around in your mouth and you end up having to use your tongue and your lower lip to kind of hold them in. People don't have a lot of confidence speaking and chewing with these things, so when we're able to put the mini dental implants in, we usually use about 4 on that. It's called 4 on the floor. Their life absolutely changes. When you can wake up in the morning and not worry about what that lower denture is going to do, whether you're speaking, chewing, whatever you want to do with it, big time change.
This is where I think the patient really needs to understand. Folks, if you have a lower denture, like Dr. Ney just mentioned, and it's floating around and you've used that goop or that adhesive, first of all, you're swallowing it, it tastes terrible. There's that sense of confidence that doesn't exist because your teeth could fall out if you're with your grandchildren, your children, your friends and family. This is not going to move around. Here's my thumb. This is the titanium post that Dr. Ney mentioned that goes into the bone. The mini dental implant adheres to it, does not move, snaps into place. Imagine that sense of self-confidence that comes back.
You can't really explain it. Only they can really explain it to you because it's been such, you wake up in the morning and you just are constantly thinking about it. When that kind of anxiety is gone from your life changes, your life opens up.
And most people think, doctor, my parents had dentures and, people have just grown up with the acceptance that this is how it's going to be. It doesn't have to be that way. That was then and this is now. The goop is gone. The old-fashioned thinking about dentures
exactly right.
is just not going to
That's exactly right.
exist.
The options are out there, and that's the biggest thing about patients. They don't know where those options exist. They exist at my office, and I can certainly talk about them with you, but the bottom line is there are options out there for you.
And Dr. David Ney, by the way, is at 4938 Highway 49 South in Harrisburg, North Carolina. The phone number here it is 704-742-2400. And the website is neydentistry.com. We have another example, Doc, of a full set of teeth. This is a really interesting model to look at.
And this is for the individual that doesn't want any more plastic in their mouths. And what they really want is they want to have teeth. They want to have teeth back again that they haven't had for however long it's been. Again, this is a situation where the mini dental implant solution is certainly there. We put in a number of the mini implants. And what we're able to place on there, we either cement it on or we're able to place it on and we're able to clean it for you when you come in for your cleanings, is a full zirconium set of teeth. And so it's just like having your old set of actual teeth back. It's a whole nother ballgame.
So this is almost like God has given you a brand new set of teeth all over again.
A third set, if you will,
yeah.
Right? Absolutely.
And the way you care for the mini dental implant, whether it's a full set or the upper or the lower, we'll talk about that in a little bit, but you keep this clean, your confidence comes back, and now you can bite into the foods that you're used to biting into, and you have that sense of confidence again.
I don't think we can properly describe really what that's like for the actual patient to wake up in the morning and actually be able to not worry about something that they've been worrying about for however many years they've been worrying about it, right? It's just a game changer for them.
And this set that we're showing now is something you can take out, or you can get an advanced level of mini dental implant where it's cemented in.
Exactly. Yeah. So we can either cement this so it never comes out, or it only comes out when we take it out.
And let's look at the last example. If you have a single tooth in the front, say, of your...
This is what really makes mini dental implant, in my opinion, one of the most versatile things that you can do. You've got patients coming in that have just that one space. They don't know what to do with it. It's been there. They've maybe used a flipper. They maybe used a bridge, what have you. It hasn't worked because they all fail at some point. Boom, we can get this little mini implant in there and we can place a tooth into that space and the solution is done. And you can floss this very easily to the implant itself. You can take a little water pick, clean it out. It's an easily manageable tooth.
And I mentioned the single tooth because if you have a sports injury,
absolutely,
it doesn't matter what your age, you might need a mini dental implant. You could be in high school.
Absolutely.
And your tooth is knocked out at a sporting event.
That's right.
This is something for any age. And then on the side, if you have some teeth that are missing in the back.
Great situation. We see this all the time, right? This is not anything abnormal at all. People are missing upper right teeth or upper left teeth, multiple teeth. What's great about, again, the mini dental implant is you don't need a lot of space. You don't need a whole lot of bone. All we need is a little bit to put the implant in, and we can fill that space in very easily splinted together, and boom, you got teeth.
And it's important because even though you're saying to yourself, well, they're just teeth in the back and nobody sees them. Oh, no, 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 no. Because you're chewing.
Absolutely.
The teeth in your mouth will move and become deformed if you don't have that support.
That's right.
And the fact that you just want to look and feel your best. And
That's right.
And your face needs to be full.
Some people may say, you know, the patient will say, or will say, we don't see that space anyway, but they'll say, I see it. And that's all that really matters. The patient sees it and they want it solved, and we can get it solved for them.
How long have you been working with patients with the mini dental implant?
We've been doing it for about 2.5 years now.
Yeah, about 2.5 years. So this is relatively new practice for you. And if somebody has a denture, you can work with the denture they currently have or create a new one for them.
We absolutely want to use that denture as an actual treatment denture, make sure that everything is properly the way it should be, and then we make a final denture at the end.
And you've learned about the mini dental implant procedure from a very prominent dentist who practices in Buffalo, New York, Dr. Todd Shatkin.
Yeah, Todd Shatkin has a great practice in Buffalo. And, you know, honestly, I was kind of searching because of the big hole thing that we were talking about earlier. I didn't want to put those kind of holes in other people's mouths. And I was searching for, there had to be a better way out there. Todd Shatkin, obviously, he's been doing it for 12 years, I think, or something. He's done all the hard work for us to let us know that, hey, this thing works and there's confidence to it, and it's a smaller hole. It's just, there's not a better way.
And you have kept up with the latest techniques. So if you go to see Dr. David Ney at 4938 Highway 49 South, everybody knows where Highway 49 South is.
They do, they absolutely do. It's a traffic jam in there. So they're gonna go by my practice at some point during the day.
Because everybody from the greater Charlotte area here is there and available to see you.
That's
so
right.
Maybe they'll see you as they drive by in
Exactly.
the traffic. But 4938 Highway 49 South, Harrisburg, North Carolina, NeyDentistry.com. That's where you want to find out more. So now, Dr. Ney, it's time to get to know you a little bit.
Sure.
How did you get to practice here in Harrisburg, North Carolina? Where are you from?
Well, I was actually brought up in actually Rochester, Minnesota. I went to school at Arizona. I was a blackjack dealer for a while, and actually in Lake Tahoe, and ultimately found myself back in Minnesota for actual dental school. Didn't want to stay there very long because it's real cold up there, right? And so ended up going down to Atlanta, and from there, really, the Lord kind of allowed us to go into Carolina. He kind of led us there, and so North Carolina is where we ended up.
Yeah, and you're raising your family here.
Raising the family, got a little 10-year-old and a 16-year-old, which you think stress is, 8 hours a day at the office. It doesn't start till you get home.
Yeah.
Right?
Well, you're blessed with a great family.
That's right.
And blessed with a great practice.
Thank you.
And so with that, Dr. Ney, let's talk about your staff, because they are like family as well.
Yeah.
Talk to me about, I know Miranda and Darby, you had talked with us a little bit before.
There isn't anything that those two would not do for the practice. They have constantly sacrificed for the practice. We have a very tight, stout practice, meaning that we're on time all the time. Everybody works as a team. We've been able to hire 2 more people, actually, Miranda 2, if you will. She's working at the front desk, and a lady by the name of Lorna has also joined us for hygiene. So it's a good practice.
Talk to us now about the fact that you can also offer restorative general dentistry. So if you're out there and you're looking for a dentist and Dr. David Ney has piqued your interest with the mini dental implant, you can go in for that. Or if you're looking for a dentist, you can go in because you do all kinds of dental work.
Absolutely, and when you're in school, you learn how to do the root canals, the fillings, the extractions, the bone grafts. We've learned those things, and after 21 years, we've really perfected those things. That's a thing that we do very, very well.
You talk about free consultations, because if somebody's interested in the mini dental implant and they come to see you at 4938 Highway 49 South, what will you talk to the patient about?
The biggest thing I'm going to ask them is, first of all, what do they want? And they're going to let me know what are their goals. And once we know what their goals are, we're going to let them know what the options are for that. So we're going to set them through, just like we kind of talked about here. We're going to show them what they have, what kind of bone they have. We're going to show it on the x-ray. We're going to show it on the models, and we're going to plan it out.
And talk to us about, cost. I mean, we've talked about the fact that mini dental implants are 5 times less invasive, less pain and discomfort, less healing time, less visits to the dentist, and less expensive than the traditional implant. And you work with the patient to make sure that the costs are something that they can handle. I mean, you do a free benefit analysis when somebody comes in with insurance as well.
Absolutely, yeah, we will do that. There's also three different financing companies that we use to finance. So we are looking for ways to make it happen for you. We will find a way.
This was really affordable.
I would definitely recommend mini dental implants to everyone.
Very happy with it. It looks natural, it feels natural.
I wish I would have got it done a long time ago.
It's the best decision I ever made, so it's well worth it.
So Dr. David Ney is going to make the mini dental implant work just for you. And because, folks, this is an investment in yourself. you know, if you've thought about dentistry for yourself and you think, well, I just have to get my teeth cleaned. No, no, no. This is something where if you're getting into a new relationship, a new job, or just the sense of self-confidence, a mini dental implant and general important dental work is something that really is, and it's not that big a cost.
No, and the thing is, that's why it's so important to come into the office, because what they're going to learn is that they can do it for themselves. A lot of people think they can't do it because they've got other things they got to worry about, financial responsibilities. This is something that you should and can do for yourself, and the only way that you're going to know that is if you come into the office and actually find out, but I'm telling you, it can happen.
So again, it's not only the self-confidence, but chewing, eating the same, the foods that you love, eating the foods that we love here in North Carolina, especially our barbecue and chicken and turkey and corn and steak and everything. We're going to get, and the sense of taste that's going to come back.
Absolutely.
You have done, Dr. Ney, some incredible charitable work, and I think this is amazing. It speaks volumes about you as a person. Tell us about your missions of mercy in Africa.
Well, let me tell you, in 2008, really kind of the Lord opened up an opportunity for me when I was at a shop, and I heard a guy talk about Africa. And when I heard Africa, I knew I'd wanted to go to Africa since I was 22 years old. And I heard Africa, and I said, I got to get there. The Lord's given me this opportunity. Boom. So we got over to Africa. I've been going since actually 2008, so it's 2018, and we've been going for the last 10 years. It's a great opportunity, and I'll say we're able to put a makeshift dentistry office, if you will, in about 2 minutes now. But the very first time that we actually went over there in actually 2008, we didn't know what to really expect, and I kind of brought over everything. And so what we did is we were in this actual church, which we haven't been in since. We always go outside now, but we had this little two-step thing where I was on the top step and the actual patient was on kind of the bottom step, and we had people out kind of facing the actual patient. So I went to get someone numb. I kind of looked out there and saw some expressions. I saw people kind of making some noises. So I talked to my African translator, and they said, what's going on? They said, turn the people around. This is no, spectator sport, right? So I said, oh, of course, we got to turn them around. So the thing that I learned about that very quickly is it doesn't matter what actual language you speak. People don't want to spend a whole lot of time in the chair if they don't have to.
So there you are in Africa, and it was interesting because you had met somebody here in stateside that was working in Africa and had some connection, and I remember you said to him, I'm going to go. And he didn't believe you.
Yeah, he didn't believe me, and I can see him right now. I just looked over at him and I said, yeah, I'm going to go, and he goes, yeah, I've kind of heard that one a few times before, and I said, no, I'm going to go. So that's exactly right, and he still hears that here and there. So.
Well, thanks for giving back to the world, Dr. Ney.
Not a problem at all.
With what you've done.
It's our pleasure.
And here in North Carolina, again, serving everybody in the greater Charlotte area, you're helping people. Tell us the story of a patient, a woman who was originally from England.
Yeah.
Because I think it's a fascinating
She's
testimony.
a great gal. She's a great gal. And she just showed up one morning. Literally, she had not called. She was in a panic. She just knocked on the door. It was like 8 o'clock in the morning. She had lost her tooth. She had a 3-unit bridge in the front. So one of her teeth right here, the little space tooth, if you will, was gone. And she was in a panic because she had a big meeting that day. She didn't know what she was going to do. She was at the point where she was going to call in that day. I said, listen, we can do something for you. Let's take an x-ray. Let's kind of see what's going on. Found out there was more than enough bone. We were able to put a mini dental implant, just like we talked about, very versatile. Able to get it actually temporized that day. She left that day smiling, absolutely ecstatic. I mean, her day changed. Her life changed that day.
Her whole life changed.
Her life changed that day because now she knew the options out there. Plus, she was able to go to work and get things done what she wanted to get done that day.
Getting the mini dental implants was a life changer for me.
Not a second thought about it. I would do it again. This is something that is so incredible.
I feel a lot more confident. My smile feels better.
It brought a lot of confidence back to me.
I feel like I do have more confidence than I did before.
Totally pleasantly surprised at this whole dental experience here.
If you go to the website for Dr. David Ney at neydentistry.com, you'll get a chance to read some patient testimonials, and I wrote some of them down here. I've been to several dentists, but Dr. Ney treats his patients with genuine compassion and sincerity. These are testimonials about you. It speaks volumes. Not only does Dr. Ney put a person at ease, but his entire staff makes you feel comfortable. And we have some video that we want to show you from one of the patients that you'll get to see if you go to neydentistry.com.
Hi, my name is Kim Carlson. I have been coming to Dr. Ney since I was new to the area, I guess 8 years. And needless to say, he had his hands full with me. And I couldn't be happier. 8 years later, I'm still seeing him, and he's just as nice the first day I met him as he is 8 years later. And I also have to compliment his staff. They're very friendly.
And Dr. Nye, these are just some of the stories that are happening on a day-to-day basis at your practice at 4938 Highway 49 South.
These patients are out there everywhere. Everybody has something like this going on. I mean, we see them every day, and it's just a matter of saying to themselves, I want to change this. In fact, this was interesting too. We had another patient, and literally we had seen her 4 years. It's been 4 years, and she was one of those patients that just didn't really want to do anything. And finally she said, I am tired of this space. Is there anything that you can do? And that's when the whole light bulb just went off. And it's like, these patients exist. All you need to do is keep bringing them the options, and eventually they're ready.
And these mini dental implants, folks, that we're talking about, these are, as we said, made in America, and it's a porcelain product, so the tooth is able to take a licking and keep on ticking, as they used to say. And in addition to that, it's something that the confidence level will come back. The fact that you're not, if you're in a public place and you're feeling a little skittish about my tooth is going to fall out or my bottom denture is going to fall out, not the case.
Right.
And these patients that you're helping, they have had their lives changed.
Absolutely. Yeah, absolutely.
If you're looking to have the mini dental implant done or some other dental work, if you're putting something off, you shouldn't, because it could make a problem worse. I'm sure you've seen that, where people just, they say, well, I don't want to come in. Why don't they want to come in? Why are people still afraid of going to the dentist?
I think that there's probably a myriad of actual reasons, but the bottom line is they don't think that they can be actually helped. And I think they're tired of hearing the fact that I'm going to have to use this denture or this partial all the time. I'm never going to hear anything new. And I think that's the major issue. And until they come in, until they see these kinds of things, their lives are going to change dramatically.
And when we say there's less pain and discomfort, we're generally talking about maybe sort of an over-the-counter Advil, if you will, that would just mitigate some of that pain right after the first day.
Absolutely. And I've had patients where literally they are like, are we done yet? Because it literally from the pilot drill to the actual implant, it could take 10 minutes. And it's not a speed thing by any stretch. It's just a simple thing. And that's why it is such a great thing.
It was totally painless.
What pain? I had no pain.
I didn't have any pain. It didn't hurt.
I never felt a thing.
There was no pain, no discomfort whatsoever.
One trip, it's great.
One visit, you're done.
Less trips, the better.
It's actually really painless, and I wish I would have got it done a long time ago.
So I did it, and I'm very happy with it.
I left again with a tooth that day. I took one Aleve that evening, and that was it. Yesterday, I had 4 implants put in here. I took 3 Aleve, and that was it. And today it's just a little sensitive if I touch it, but I have teeth there now. It looks good.
It was good.
And again, going back to age, if you're a little older, it's okay too to get the mini dental implant. Why not look your best, no matter what your age?
Exactly.
I wanted my smile back like I had when I was a younger person. I had my procedure a few months ago, and it went great. No problem. I love them. I truly thought that it would be very, very painful. And I was amazed that it only took a little over an hour, and when I went home, I could basically eat everything again. Everyone notices, you know, that I smile more, and my confidence is better now than it ever has been, and they're amazed how, you know, how it changed my whole life.
You know, Doc, with the fact that care for any dental problem that you've got is so important, the mini dental implant, you can help keep them clean with a water pick.
Absolutely. Very simple to clean. If you have one of those single tooth implants, you can actually floss to the implant just like any other implant. You can keep it clean by actually toothbrushing and or using the water pick. Very simple. In the few minutes we have remaining here on Innovations in Health, let's take a look at the models again. We've talked about the mini dental implant. Let's take a look again. We talked about the single tooth that patient, that fine patient of yours had. Let's take a look Exactly. Same situation. Again, in fact, this was a situation where she had a bridge. So in between this little space tooth is where she didn't have any teeth whatsoever. And so in that panic, we were able to put in a nice little implant, place a little temporary. In this case, we will put a crown in there ultimately. Her life just got better.
And on the side, let's again show the side teeth.
People that have those spaces on the sides that they don't think anybody sees, but of course they see, and they know that they're there, we can fix those for you.
And it's the titanium post that goes right in, and see how the teeth just click right in?
Click right in like that.
And so now the bottom mouth or your top
fit the upper.
Fits, and it
exactly.
will make your mouth feel full again.
Absolutely.
I'm going to give you another example here. as I pass over it. This is an example of
The lower denture, which is also called the floating denture, causes the most challenges in anybody who has a full denture. This can be solved very quickly by having 4 mini implants placed.
And we talked about that titanium post. So again, folks, it's that post that goes right there, and the mini dental implant adheres to it. You heard the click, and it doesn't move. No goop. Imagine that, everybody. How many of you have complained about the goop? It tastes terrible. That's right. Goop is gone, Doc.
Goop is gone.
All right, here's another example.
Upper one, another great asset of the mini implant. Getting this palate out of the way allows you to taste your food again, allows you to feel much more natural, allows you to speak a little bit. Your tongue is not getting caught up in the actual palate. Great opportunity. Once again, great fix.
And it snaps right into place.
Right into place.
And the fact that you can cut out the plastic part, the palate does come back. So
palate
again,
comes back to life.
Corn, steak, barbecue, it's all coming back.
That's right.
This is sort of the
this is for the individual just top of the line who wants just a full set of actual teeth back. It's like we have said earlier, kind of having that a third set back. We put as many implants as we need in there to compensate for what we need to do. We can cement this or we can just place it and we can clean it when you come back in for your normal cleanings.
So 2 different versions there on this full set, as if God has given you a whole new set of teeth.
That's right.
This is either something that's cemented in and is permanent, or something that you, as you just showed again, you can take right out.
You can take right out, and we take it out, and we clean everything around here, and we put it back into place for you.
And folks, imagine all of that you just saw versus the old style conventional implant.
Which again is having kind of a big hole where you place the implant in the hole and the bone heals back to the implant. That's why everything takes 3 to 4 months to actually heal. And of course that tissue's been taken over, so you have to stitch that up. So there's a lot of healing time involved as opposed to this little pinhole that just integrates the implant immediately.
A whole difference.
Whole different ball game.
Yeah.
Whole different ball game.
And you have the X-ray technology, so a patient comes in, you take a look, and you're going to gauge very specifically what has to happen.
We will plan this out very specifically. In fact, we're going to make an actual stint that's going to be placed on the actual mouth that's got a little sleeve in it. We're going to have a little guide plane that's going to allow the pilot drill to go exactly where we want. This is not one of these fly-by-night things where we're kind of free burden. This is something that we're going to plan out very specifically.
Dr. David Ney is at 4938 Highway 49 South. And as Dr. David Ney said, and we all know, Highway 49 South and Highway 49, you can't miss it. That's it. Everybody travels that road.
Everybody's on it.
Yep. And it's in Harrisburg, North Carolina. And the phone number is 704-742-2400. And the website is neydentistry.com. Ney spelled N-E-Y, neydentistry.com. Dr. David Ney, we are changing, you are changing lives here in North Carolina with the mini dental implant.
Thank you very much.
You are an innovator in health, and if anybody has any interest in this, you must see Dr. David Ney. Now is the time to change your life, change your look, right, Dr. Ney?
Absolutely.
Thank you very much.
Thank you very much.
You're welcome.